Excuse me, I'm being interrupted. We have a media advisory alert. We're just told that there's been a crash on I-95. And we have to break for a moment from the ceremony. The helicopter is landing with the patient as we speak. Take over.
Ladies and gentlemen, your attention please. There's been a car wreck on Highway I-95, and we are getting some patients. A pregnant woman in labor and on her way to the hospital got injured. Tonight, I'm going to walk you through a live case. You will see how the simulation center works and how we stage medical events. We have created a medical environment that is realistic. Actors as patients, a real operating room, a real intensive care unit, and state-of-the-art mannequins. All of this, everything we've done tonight, has been created to train better doctors, nurses, and technicians to reduce medical errors, to make medicine safer. So fasten your seatbelts. She apparently didn't, and I will guide you through this case as it unfolds. Our first step is the exam room, where they will try to get a diagnosis. And in this case, you saw our patient, an injured pregnant woman. Let's listen in and see if we can hear what they're saying. The first goal, see what the vital signs are.
Have a radial pulse.
Blood pressure is low.
Yes, please go ahead.
Pulse is weak.
Heartbeat's 90 and it's
Chest
going
pressure of
down.
100.
And they are having a hard time hearing the baby's heart.
She's closed lung mouth.
I'm set with
The
the
mother's
idea.
condition is not good.
Give me one more blood pressure.
If you are not careful, we are going to lose mother and baby within minutes.
She bleeding?
We have to go to the operating room, and we have to go right now. They are going to have to get that baby out quick. That baby is in trouble. Let's save
We're
him.
getting ready to get you off to sleep.
The anesthesiologist will be giving some drugs soon.
Michelle Tavares for emergency C-section.
Everybody concur?
Concur.
Time out taken.
Okay, ready
So
for
let's take a
induction.
look at this patient.
Coracoid pressure.
Bovie.
The mannequin is connected to a computer and controlled by Captain Elia
No, we
in the
need still
control
need
room.
another minute.
Through one-way mirrors,
Vitals are stable.
Elia, watching
Good
there, you
oxygenation
can see
so
him,
far.
can watch what's going on and change the scenario on the fly as
I
it
can't see
progresses.
anything.
He can change the condition of the
Here,
mannequin,
let me take a look.
change the blood pressure, and the team has to react.
No, it's looking pretty bad. Let's fix
For
this
medical
headlight and
students,
we'll
for
try the
example, we
Nelson
make a
technique.
pretty simple scenario. For old, graying guys like, well, me, we make it pretty tough.
Everything's finished.
The whole idea
Are you guys there yet?
is to make people
No, not
sweat
yet.
during
Need more
these
time.
things.
So you're starting to get a little tacky. Rhythm's changing now.
Finally, an audio-visual system, which is all around the
Your shots
operating room,
dropping.
will see and record everything that happens.
130s, 140s.
We call it the lie detector. The obstetrician, that heart rate sounds pretty fast. The obstetrician wants to operate right away, but the anesthesiologist
Almost,
has to
almost
first
gets
establish the airway
All right.
and then get blood into the patient. If the anesthesiologist has
160s.
trouble with that airway, and it sounds like they were having some trouble, in a minute,
Have to
this
go
could lead
with
to a
the
cardiac
element
arrest.
if This doesn't go.
Yes, they are having trouble with the airway.
No, we
Not
need more
yet.
time.
Let's see if we can help them out. Elia,
We need to get this
let's
baby
stir
out.
the pot.
Hang on. Just
Let's
need
make
to
a bad
secure the
heart rhythm.
airway.
No. Elia, make a fatal heart rhythm. Put
Okay,
that
looks like
patient
we got
into
a problem here. Do you
ventricular
feel the pulse? Looks
fibrillation.
like we have VFib.
That is a
Knife,
fatal
please. I don't
heart
have
rhythm
pulse.
Need to go.
that will
Okay,
kill
let's
the
grab some
patient and the
epinephrine.
baby within minutes.
Incision, skin incision.
Let's see what this crew is made of.
Let it bleed.
The team will now try to
Epinephrine
resuscitate
in.
the mom.
In, tube is in. Okay, good.
And the only way you can do that is getting the baby out quickly.
Knife down, please.
You cannot do CPR on a pregnant lady. You've got to get the baby out.
Knife down.
Knife down.
You see the obstetricians there are performing a cesarean
Putting
section.
her on vet.
For non-medical people, a cesarean section is deli-
Give her a little jab.
Go ahead, secure the tube.
This baby is very silent.
Thank you, Dr. Labarsky. You'll note the baby is hypoxic. The baby is all blue, has no oxygen in it. The
Arm is very
pediatric team
low,
will
but
resuscitate
it
the
is
baby, and
speeding
as
up.
you watch,
You're getting
you will
oxygen
see the
in there.
baby go from blue and
Right.
pink right up.
Starting to pink up a little bit.
You'll note we have baby-sized mannequins too.
Good work, good work.
That's Inspector
The
Incision.
next place we're going to go is the intensive care unit. So we're leaving the operating room behind. In this area, the pace tends to be a little slower, a little less frantic, a little more deliberate, and use a lot more equipment. Here we have Dr. Miller, one of our ICU specialists. And here the doctor is going to check his handheld PC. So that hooks up to our wireless computer network so he can check lab data, x-rays, patient ID. The whole idea is you want to make sure it's right drug, right dose, right patient. The final phase of the simulator is the debriefing. The debrief is where we try to make sense of what happened in the chaos of the OR or the ICU. Every event is viewed as a mystery that you try to solve,
Patient.
not a crime that merits punishment.
We have this new incident reporting system from STARS and AIMS to allow us to evaluate these incidents. What do you think we could learn from these events?
You know, I was concerned. She didn't look good, and that's why we, moved into the mode we did.
How was the work with the obstetrician? Was it smooth?
Absolutely.
How's the mom and the baby doing? Do we know?
Baby's doing very well. A good APGAR score at the end.
Good.
Crying.
Why did you do what you did? What was the best thing? What could we do better next time? The goal in the
Get this woman
debrief
into
is to break
better
down
care
the
or
event.
Anything we could have optimized the care?
What would you do in real life? What would you do next time? What would you do differently? Simulation is at the forefront of medical education. Best part, this whole thing was done at no risk to any patient whatsoever.